Anti-asthmatic drugs. The drugs which are used to cure the asthma is called anti-asthmatic drugs. Here, bronchial asthma is characterized by the hyper-responsiveness of tracheal smooth muscles to a variety of stimuli, resulting in narrowing of air tubes, often accompanied by increased secretion. Mucosal edema and mucosal plugging will occur. The symptoms include dyspnea, wheezing, cough, and many may be limitation of activity. Asthma is recognized to a primarily inflammatory condition. In other way, a variety of trigger factors, infection, irritants, pollutants, exercise, exposed to cold air, and psychogenital may be involved. These are the symptoms of asthma. And then the main mechanism is the mast cells and inflammatory cells are required as a result of initial reaction to produce a multiple mediators by the following process. Release of phospholipids from cell membrane followed by mediators synthesis like PGS, prostaglandins, leukotrienes, platelet activating factors, and the activation of genes followed by the protein synthesis will occur. And the drugs which are used to anti-asthmatic condition is here given classification. The bronchodilators, leukotriene antagonist, mast cell stabilizers, corticosteroids, anti-IgE antibodies are anti-asthmatic drugs. These are classified into five types. They are bronchodilators, leukotriene antagonist, mast cell stabilizers, corticosteroids, anti-IgE antibodies. Okay, then bronchodilators again divided into three types. They are beta-2 sympathomimetics, methylxanthines, anticholinergics. In beta-2 sympathomimetics, salbutamol, terbutamol, salmeterol, ephedrine are the essential drugs. In these drugs, salmeterol is the long-acting drug. And here comes to the methylxanthines, theophylline, aminophylline, doxophylline are the drugs. In anticholinergic classification contains ipratropium bromide, tiotropium bromide are the drugs used in the asthmatic condition. This classification is defined as and classified. The classification how it is gives means the classification contains main mechanism of action. Here leukotriene antagonist which antagonist the leukotrienes in bronchial muscles, like the drugs are montelukast, gefirlukast. These are the antagonists means which antagonize the leukotrienes. And then mast cell stabilizers. They are sodium chromoglycate, ketotifen, and corticosteroids are used. In corticosteroids, they are contained two types, systemic and inhalational. In systemic corticosteroids, hydrocortisone, prednisolone are there. In inhalational corticosteroids, beclomethasone and fluocinolone is used as a anti-asthmatic condition. Anti-IgE antibodies are omalizumab. Only the drug is used in anti-asthmatic condition. Here comes to the bronchodilator agents. These are the agents which widening the air passage by directly relaxing the bronchial smooth muscles, like salbutamol, salmeterol. We already seen. What is the mechanism of action means here salbutamol is a beta-2 adrenergic receptor which antagonists the principal treatment of asthma and also used in COPD, chronic obstructive pulmonary disorder. Here, the main mechanism of action of salbutamol is it is a beta 2 stimulating agent which stimulate the beta 2 receptor. After that, activation of G protein coupled receptor will occur, which increase the CAMP levels with bronchial smooth muscles, which reduce the calcium dependent coupling of actin and myosin filaments. Here, simple beta 2 receptors are bind to the beta 2 receptors are stimulate the GPCR and it increase the CAMP levels. It causes decrease in calcium levels by the inhibition of actin myosin filaments. And then this is the main mechanism of action. And here comes to the pharmacological actions. We can see the salbutamol causes relaxation of bronchial smooth muscles, and also the uterine smooth muscles also relaxes by the taking the salbutamol, and also salbutamol causes relaxation of gastrointestinal sphincters. The contraindication drugs which are not taken to this asthmatic condition is tachycardia when the patient having pregnancy, lactating mothers are contraindicated to the salbutamol drug because it causes contraction, so its chances to the abortion. So that's why it is not used in the diabetic patients and pregnancy like lactating women. And the adverse effects are tremors, hyperreactivity, nervousness, insomnia, headache, dizziness, drowsiness, restlessness, nausea, vomiting, diarrhea, heartburn. These are the. And the therapeutic uses is mainly used in the asthmatic condition and also chronic obstructive pulmonary disorder condition. Also, the salbutamol drug is used in that condition. And so many drugs are there. Each drug will be explained here and it will be main. And thank you.